This too shall pass. I'm Dr. Jim. I want to talk about potential consequences of social distancing. So, recently we've been told by government officials that social distancing can be one of the most effective ways to reduce the spread of coronavirus or COVID-19. It can also help reduce the strain placed on our healthcare system. Social distancing involves the act of avoiding large social gatherings and close contact, which is defined as 6 feet. Okay, so staying at least 6 feet away from other individuals. Now, this is something that most Americans simply are not used to doing, especially in large metropolitan areas like New York City, Los Angeles. It's really not normal for others living in mid to small towns across the United States. Not only is social distancing something that is alien to most Americans, it may have unforeseen consequences during the crisis, as well as residual effects long after the emergency is over. And that's really why I'm addressing this, because some people may not do so well with social distancing. Let's talk about social isolation and health. Over various periods of time, people who self-isolate run the risk of developing emotional reactions like stress, anxiety, and depression. They may also experience physical health problems like heart disease, dementia, and unfortunately, sometimes even death. Some studies show that having social contact with other people actually reduces our stress and even blood pressure. The perception, even the perception that we are connected to one another can give us great peace of mind. America's elderly. I'm a gerontologist. This is really one of my biggest concerns right now. Older adults and seniors, particularly those living alone, are at an increased risk of emotional and physical health problems. Those who are already lonely, isolated, or depressed may experience an increase in their symptoms. Many seniors have chronic health conditions, have few to no friends or family members, and live with hearing loss and poor eyesight, all which create a worse situation potentially for them. Now, we're all different. Each one of us is different. Some people will weather the storm with great resilience and steady nerves, while others will find it very difficult to cope with social distancing and isolation. Important facts to consider are an individual's current mental state and their coping abilities. How are you doing? Individuals may be more vulnerable if they are dealing with substance abuse, social anxiety, depression, or other pre-existing emotional or physical issues. Now, can technology help? It certainly can. During times of social distancing and even self-isolation, which I'll get into in another video, cell phones and computers can keep us connected. We could use email, texting, Skype, Snapchat, Facebook, Instagram, all of these, and there are many others. So although we can't be together physically, these means of technology can allow us to spend some good quality time together and at a distance for now. Some will argue that much of in-person communication cannot be expressed long distance, like body language and facial expressions, and I get that. But I tell you what, it's the next best thing. So I would rather stay connected with people through the use of technology than not interacting with family, friends, colleagues, and others. My final thoughts. No storm has ever lasted forever, and to be sure, the coronavirus, this outbreak, is going to peak and start to drop. If staying away from each other right now and hunkering down at home for a little bit of time, several days, weeks, maybe a month or two, is the best medicine to slow or prevent the spread of this virus, then let's all make the best of it. Use your cell phone and your computer to stay in touch with family, friends, and especially older adults and seniors who might be home alone. I'm Dr. Jim. Stay tuned for more information on COVID-19 and take care of yourself.